If you're trying to get pregnant, knowing the exact time you ovulate is of absolute importance. This is because knowing the right time that you ovulate will help you to have intercourse at the right time in order to achieve pregnancy. But unfortunately, a lot of women who are trying to conceive do not ovulate. This is heartbreaking. However, in this video, I'm going to be telling you the exact signs to look out for, which could indicate that you are not ovulating. If you're seeing me for the first time, my name is Peace Tracy, a registered nurse and midwife, and I currently practice with NHS in England. If you find this kind of content interesting, consider subscribing to my channel because here I talk about women's health, fertility, and everything else. So let's get started. The first sign to look out for is irregular periods. An irregular period simply means when a woman does not see her period when she is not pregnant. Yes, you're not pregnant and yet you miss your period. Also, it could refer to a woman whose menstrual cycle is longer than 35 days or shorter than 21 days. When you have a short period of 21 days, it simply means that your body won't have enough time for the egg follicles to get to maturity. And this means you won't be able to release a mature egg at the end of the month or in each menstrual cycle. So this is what irregular period simply means, and it is a sign to look out for, which could indicate that you are not ovulating. The next sign is when you do not experience a sustained temperature rise in your cycle charts. Let me explain. What this means is that as a woman who is trying to conceive, in order to find out the time you ovulate, it is expected or it is important that you keep a cycle chart. In keeping a cycle chart, you're expected to take your basal body temperature every day for at least 2 to 3 months. Comparing this chart of 2 to 3 months or more, your healthcare provider will be able to tell you the exact times or the exact day that you are expected to ovulate. Now, for instance, if your basal body temperature does not show that dip, which should be seen just before your ovulation, it is a sign you are not ovulating. And also, if you do not see that sustained temperature rise that occurs immediately you ovulate or immediately the egg is released, it also shows that you are not ovulating. Now, let me explain what this basal body temperature is and how you should take it. Your basal body temperature simply means the lowest temperature of your body. You usually get this basal body temperature at the time you wake up first thing in the morning before you eat, drink, or do anything else. So in taking this basal body temperature, you use what we call a basal body thermometer. So this thermometer is specifically for checking the basal body temperature. So with this thermometer, you insert it into your mouth and you do it first thing when you wake up. Now, the first thing to do, which is a rule, is that it must be taken at the same time every day. So you can set an alarm clock for this. Let's say, for instance, you wake up every 6 a.m. So if you set an alarm for 6 a.m., you must take this temperature every 6 a.m. for 2 to 3 months. So the next thing is that you must not eat or drink before you do this. Then the next thing is that you must not get out of bed or try to do any work at all. So the best thing is to keep this by your bedside table, and as soon as the alarm rings, you insert the thermometer rather in your mouth, and then you check the temperature. Another thing you must do is that you must have at least 3 consecutive hours of sleep before you take this temperature. So doing all of this will help you to get the accurate temperature, and this method is very reliable and inexpensive. So having taken this temperature, you will notice that while looking at the graph, just before you ovulate, there is a dip. Usually it is about a degree. And as soon as you ovulate, there is a spike in temperature. So if you do not notice this spike in temperature, it is a sign that you are not ovulating. Having very light periods are another sign to look out for. So if you notice that your periods are very, very light, it could be a sign that you are not ovulating. And having light periods could be due to anovulation. Anovulation simply is a situation whereby your ovaries fail to release a fertilized egg. And remember, Menstruation occurs 10 to 16 days after a released egg is not fertilized. So, some people might think that if you do not ovulate, you're not going to menstruate. No. In most circumstances, even when you do not ovulate, the uterine lining still sheds. So the shedding of that uterine lining is what you see as those light periods. So if you notice that you constantly have very light periods, it could be a sign that you are not ovulating. And having this kind of period is what we call abnormal uterine bleeding. It is encouraged that if you notice this symptom, you should seek the help of a medical practitioner. Another sign is having multiple positive ovulation test results. So if you notice that each time you test for ovulation, it comes back as positive, irrespective of the time in your menstrual cycle. Even when you're not supposed to be ovulating, you notice that the test still comes back as positive. It could be a sign that you are not ovulating. In fact, this kind of thing is usually observed most common in women who have PCOS. So women with PCOS always have these false luteinizing hormone surges which trigger ovulation. So their body tries to ovulate, but it actually does not achieve ovulation. So this leads to that false positive test result for ovulation which women get. So this could be another sign that you are not ovulating. Finally, if you notice that your cervical mucus does not have changes, it could be a sign you're not ovulating. So there should be a change in your cervical mucus anytime you're ovulating. It should be more stickier, more wetter, and it should have this stretchy effect like that of an egg white, a raw egg white. That is how it should be. But if you notice that there are no changes, it could be that there are no cervical mucus even, or that it appears dry and sticky, then that is not enough for a woman to get pregnant. It could be a sign that you're not ovulating. So look out for these signs. And if you identify any of these and you're finding it difficult to get pregnant, it is really advised that you seek the help of a qualified healthcare provider who will actually assess your situation holistically and give you a personalized care. And I wish you success in your journey to conception. So if you've noticed any of these signs, kindly leave a comment in the comment section. Ask me any questions you have. And it's also very important that you seek the help of a qualified healthcare provider who will assess your situation holistically and give you personalized advice and treatment. Thank you so much for watching my video to the end. Do not forget to like, share, and subscribe to my channel because here I talk about everything women's health, fertility, and everything health. So, see you in my next video and bye for now.